Come if you just joined us, so this is the breast cancer awareness conversation right here on Tech TV. My name is Linda and I am your host for this conversation. So I have with me here another badge who has joined us to continue this conversation and also talk about the breast cancer awareness. So I have with me here Josephine Siama and then Miss Hawa Abubakar coming to continue this conversation. You are welcome.
Thank you very much.
You are welcome.
Thank you very much.
Alright, so let's start from you, Miss Josephine. Tell us some risk factors about the breast cancer. Yes, because there's definitely something in there we have to know. Talk to us.
Thank you very much. So talking about the risk factors of breast cancer, I'd want to begin with the family history. So if the person has a family history where breast cancer runs down through the family, or there's maybe some gene mutation from one of the person's family members, the person stands at a high risk of getting breast cancer. Also, the person's personal history. If the person has had breast cancer before or any non-cancerous breast disease, the person can also stand at a risk of getting breast cancer. Also, talking about if the person consumes alcohol, yes, the person can stand at a high risk of getting breast cancer. And if the person smokes cigarettes, the person can also get breast cancer. And for those who menstruate at a very young age, let's say before 12 years, they stand at a high risk of getting breast cancer. And also, if your menopausal stage is late, you can also get breast cancer. Because one of the risk factors is getting old. So if you are having your menopause like after the set time, you can stand at a high risk of getting breast cancer. There's more, but these are the few I would want to talk about.
Does it mean that at a point the breast cancer becomes something we cannot hide from it? Some people, as you are saying, because if somebody menstruates before 12, it's natural, right? Because menstruation is natural and something natural for women. So if you menstruating before 12 and you at a high, you stand a high,
chance of getting
the breast cancer, how do we go about that? Or is it that they should accept it that, no, I'm getting this?
No. It's just a risk factor. That doesn't mean it is a concrete reason for you to get. It's just a risk factor. There are people who would menstruate before 12 and would not get it. But it's like a risk factor. That's why we call it risk factor and we don't call it a cause. Because if we say it's a cause, it means the moment you have that, you are automatically getting breast cancer. But that's not what we are trying to put across.
Okay, so on to the next. Breast cancer doesn't just happen. I'm watching something here. Tell us about some symptoms. How do I know I'm getting this? How do I know this is on the way coming?
Okay, so talking about symptoms of breast cancer, I'll start with nipple discharge, whether being bloody or clear in color. When you're having some discharges from your nipple, it should be a sign. Also, thickening of some parts of your breast tissue or finding lumps in it. That's why the self-examination is very important. Thirdly, I'll talk about redness.
Okay.
Finding redness in some parts of the breast.
About the redness, you see, those who start menstruating, most of them are ignorant about it. The symptoms of menstruation, sometimes it starts and you get all those, some people's own are very serious. You get all those symptoms. How am I going to differentiate between this and that?
Okay, so for the redness, I'm not sure when you are menstruating, your breast becomes that red. Okay, so for the redness, it's very visible. One thing about, yes, it will be very visible. And there will be some dimpling in the breast where there will be some holes or pores that look like orange peel. You see when you take an orange, those tiny holes in it. Yes, we all have some holes around our nipples, but those holes will become very prominent. Yes, and that's one sign of you being at risk of breast cancer.
Okay, let's move on to Ada. I want you to add that because your team member talked about the men or the misconception that men do not get breast cancer, men involved in this whole breast cancer issue. Tell us about the men too.
Okay, so men form 1% of the population of people who get breast cancer. Men get breast cancer because men also have breast tissue. Yes, I know one of the risk factors of breast cancer is having dense breasts. So we would say males do not really have dense breasts, but the fact that they also have tissue, they can stand at it, because the definition of cancer is the overgrowth of abnormal cells. So if the man finds abnormal breast cells, they can overgrow and also cause cancer.
Does it mean that for men to see that they are having this, it's very easy?
Yeah, exactly. So, yeah.
All right, so that is it. Ms. Hawawu Abubakar, you are welcome once more. We will have some demonstrations, so don't go anywhere. Let's start from the stages of breast cancer. Okay. It doesn't just happen. We have stages, we all know. Take us through.
All right. So breast cancer is classified based on stages, even though we have types. With the staging, it's very important because it helps us plan treatment, or health professionals, I'll say. It helps plan treatment and then to set prognosis too. And I say prognosis, it simply means the outcome of treatment.
Okay.
Yeah, so it actually starts from 0 to 4.
Okay.
Yes, the numbering is done using the Roman numerals.
Okay.
So with the stage 0, that is the very early stage. That one is non-invasive. The abnormal cells that are growing are confined in just the milk duct of the breast. Looking at the anatomy of the breast, it's confined just in the milk duct. That one, there's no spread. That's at that point we call it ductal carcinoma in situ. Yes, that's the term, or that's how it's known.
That's the zero stage.
Yes, stage 0.
Okay, the very first stage.
Yes. Ductal carcinoma in situ, that's how we call it, or the non-invasive stage of it. And then now we go to the stage 1. That is where now the cancer cells start to spread to other tissues in the breast. So now initially it was confined just in the ducts of the breast, but now it's moving out of the ducts, it's spreading to other breast tissues. And then the stage 2, that is where tumors start to form, lumps. It could be one, it could be more. And then these tumors at this stage, it kind of measures between 2 to 5 centimeters across. And at this stage 2, sometimes the lymph nodes may be involved, the lymph nodes may not be involved.
The
stage lymph nodes.
Okay, and that one is? The
lymph nodes, they are pea-like structures that are found. They are found almost throughout the body. And then they filter lymph. Lymph is a fluid that runs through the lymphatic system. It serves as it helps boost, should I say boost, but then it helps fight immunity to pick up bacteria, cancerous cells, etc. So it's more like a filter. It filters the fluid that runs through the lymphatic system. Yes. So with the stage 2, the tumor, the formation of tumors and then spread to lymph nodes. Yes. Yes. And sometimes the lymph nodes may be involved, sometimes they may not. Then the tumor size is between 2 to 5. And then the stage 3, that is where, with that stage, the lymph nodes are totally involved. You see that under normal circumstances, the lymph nodes are not visible. So once you see a lymph node, we have some underarm, around our shoulders, is dispersed throughout the body. So once it becomes visible, then you start to suspect. It means there's something wrong with your immunity. Yes, with your immunity. Basically, we use it to, most often I would say, we use it to suspect cancer. Yes. So stage 3, lymph nodes are involved, tumors are they spread to other tissues. And then the stage 4, that is the metastatic phase. At this point, the cancerous cells have spread to distant parts of your body.
Do you think at that point we can treat it?
No. At that point, it's like...
Okay, so let me ask, at what point do you think we can do something about breast cancer? Because it starts from the very early stages. But don't you think, because I have seen in so many cases that people don't even realize that this is a 0 stage and that I am getting this. They may not realize that this is exactly what I am facing. That is a 0 because that is invisible, as you said. So how at what stage do I say, it's preventable, like we can treat it, we cannot treat it? I can prevent it, I cannot. At which stage?
With the staging, it's definitely the very early stage.
The 0 stage.
Yes. So in order to know whether, as you said, you can't really tell when you are getting it, but then that is why it's advisable to self-examine yourself. When you keep examining yourself, you tend to find certain abnormalities, then you rush to seek medical attention. So with that, to help detect it early, and then it can be cured or prevented at all.
Yes.
Because even research has it that persons whose cancers are detected very early are able to cure them of it. Yes,
and that will be forever.
Yes, not entirely forever. Averagely for like 5 years. The research says that persons who were managed at a very early stage, they went 5 years or more, averagely 5 years without the occurrence of the.
And that is certain. That if I detect it earlier, maybe at the 0 stage, I know this is what is
happening. A lot of factors are at play, everyone and how the system functions. But then, averagely, yes, that's it.
Oh wow!
Even though there are lots of factors.
That is nice. Then the 0 stage is very important because for me to be able to cure it now, I need to know at the 0 stage. So let's move on to the diagnosis of breast cancer. Tell us more about the diagnosis.
Okay. So before we diagnose breast cancer, we'll have to do some physical examinations, and then order for mammograms to check for the signs and then symptoms of breast cancer. So after we've done a physical exam, ordered the mammogram to check whatever we have to check. And then we further go on to do other tests like breast ultrasound.
They are all part of the diagnosis stage.
Yes, they are all diagnostic and investigations. Yes. So they do breast ultrasound for visualization to see the sign. We've done physical examination and we've seen this, so we want to see with our eyes, have a visual view of what is actually going on in there. So after that, we can do MRI, magnetic resonance imaging. MRI of the breast to have clear. That one is for visualization. Then we can do breast biopsy. This is where we take sample of the tissue, the tumor that is in there, to the lab for further studies and investigations. And then we can also do immunohistochemistry. That too has to.
They are all part of the diagnosis.
Yes. When we are diagnosing something,
you need to know.
Yes, you need to know. You first inspect. You have a system of diagnosis, like lay down procedures. So you have to inspect. That is, you see with your eye, you touch to feel, and then you run some labs or scans, radiologies, etc. to have a visualization to see what is actually going on inside. And that is why we have all these diagnostic investigations.
Okay, so let me talk about you saying this whole process involves money. There has been this saying that most of the people or the population, bigger part of it are poor people who can't afford the process. Tell us, how true is that? Or just anybody, or most of the people who get breast cancer, they are poor people because of maybe the food they eat, maybe, a lot. Even the water you drink, how you care for your body. Yes, so tell us, is it mostly found in poor people or?
Well, breast cancer, it doesn't, even though it has environmental factors to account very much, but it's not like certain or standard that because you are poor you get breast cancer. No, it's not. It depends. That's why she mentioned earlier that we have some predisposing factors. It doesn't really have specific causes. Breast cancer doesn't have specific causes, so it's just the predisposing factors. So you being poor, not having money, it doesn't really lead to.
So it all depends on how you take care of yourself.
Yes,
and early detection.
Yes, that's very important. That is why we are spreading the awareness, so that persons who don't even take good care of themselves, when they chance upon the screening programs, they screen to know their state. And then now too, I think we have a lot of organizations and then bodies that are really focusing on breast cancer. So we have organizations that sponsor persons who are diagnosed.
So at a stage, even if they think they can't afford it,
there are organizations that are willing to.
That is easy. Okay, so you made mention of the examination, breast, how you examine your breast to see if there is something, and that is at a very early age, 0 stage, and that is very important. Or that is, how you start to know if there is something wrong or not. Can you take us through
the breast self-examination? Okay, so with the breast self-examination, that one, you first have to stand in front of the mirror, as she said earlier, and then you look out for the signs. Okay, you examine your breast with your hands on your hip like this. You stand in front of the mirror to check the shape of your breast, the size, whether there's any dimpling, any crusting, peeling, whatsoever. Just take very good look at your breast with note any changes. And then now you either lie down. Okay, you lie on your breast with your half naked. And you wouldn't have anything on. The bra should be off. Yes. So you lie down, and then if you are starting with your right, or you are examining with your left breast first, you put your left hand at your occiputs behind your head like this. So you be lying down with something like this, and then it will be like the breast region will be flattened, like it will be very exposed. And then you imagine yourself dividing your breast into halves, like 4 equal halves, or as many halves as in a CT. And then you begin from the top region, your chest region, using the 3 fingers. If you can use 4, it's fine. Using 3 fingers, you start from the top and then you massage slowly to the nipple region. You start from let's use the clavicle, your collarbone. You start from there, you massage slowly to the nipple region. You take the other half, you do same, taking note of any abnormality, any mass. We already have ducts and then lobes inside. So once you palpate, you're feeling some discontinuity somewhere, but then those ones are normal. So as you keep doing, if there's anything abnormal, you get to know. Even if you touch, if there's any abnormality or taking in, you feel it that no, this part is not feeling right, this part is not feeling right. So you do that way from the top region. When you get to this part, it will be from the armpit side to the nipple, this side to from the bottom to the top, and then this side to same. Yes, that's one method. And then another method too is while you are still in that position with your arm here, you do it. You can do it in a circular motion, starting from the armpit region. We advise to start from the armpit region because I spoke of lymph nodes. We have some there. If there should be anything cancerous with the breast, it will be inflamed. So once you palpate, you feel it. You feel an inflamed. You feel a mass there.
Okay, before you move on, some people cannot actually do this because they might feel like I can't do it myself. Would you advise people doing for them? Maybe my mom is around. I want to examine myself. I want my mom to do it for me. Or you make it very advisable for me to do it myself.
Yes, because you know your body. You know what you are feeling. When you touch something, you know what you are touching. So you better understand it when you are doing it.
When you do it yourself.
So that's why it is a self-exam. Like this one, at least once a month, you just do the exam to check what's up with your body.
So once a month is okay.
At least.
That is at least.
Yes, at least once a month. So back to that.
Sure.
So I was talking about the fact that you can either go in a circular motion or you start from the top to the nipple region, you start to the, and the circular motion, so you do it this way, like you go round and then you end, you start from the, should I say, edges. Then you, in a circular motion, you're moving towards the nipple region. So you palpate, taking note of everything.
So just the nipple region, not the whole breast.
The entire breast. You are starting from this part, the chest region. Okay, you start from this part, first part, and then you actually start from the armpit. I said initially, then you pass through. You are palpating the whole breast,
everything.
but you end at the nipple region. So you get that you continuously. You also palpate it, like. Then you take note of everything, any abnormality. When you finish, then you come to the next breast, the same thing. Your arm would be here, and then you do the same thing with road to me. Sometimes you can stand and then do it, but it's more advisable when you lie down.
At your back to do this. Oh, this has been so inspiring. We have another person joining us. Stay with us, don't go anywhere. The conversation continues.